So we're getting ready to treat this patient. First thing we're doing here is we are getting our product ready. So the patient's had BLT cream, benzocaine, lidocaine, tetracaine put on her face and her hair. And while that's doing it, we want to give it about 25, 30 minutes at least. I'm just basically going to reconstitute these peptides. They're basically like almost like a powder at the bottom. So this is just sterile water. I'm going to take a couple milliliters of sterile water here and draw them up. That's not a great syringe. I'm going to try a different one. So we're going to do today a combination of peptides and two specific ones. One's called GHK-Cu, which is the quote copper peptide. Cu, if you remember your high school chemistry, the periodic table is the symbol for copper. Probably the oldest and most recognizable of the peptides, of the copper peptides. Works extremely well for wound healing, hair regrowth. It gives melanin, the cells that produce color back into your skin. So I'm going to just gently, I don't want to damage them, fill this up. There we go. And all we're going to do now is we're just going to, almost like you have a nice wine, it's going to turn, that's the color copper peptide. They turn that bluish color. That freaks some people out. It's not going to hurt you. And we're going to let that sit. Next thing I'm going to do, we'll save that one for here. We're going to do this peptide. This is BPC 157. BPC stands for body protection compound. It comes from the gut. It actually comes from the lining of the stomach. It's very good for GI issues. Athletes know about this very well. They call this the Wolverine peptide because, like the superhero, you tend to heal so much better. For people who have issues with ligaments, tendons, chronic sports injuries, it works well. But it's great for wound healing. So it works extremely well in combination with GHK-Cu for hair and skin. So that's our goal here. We're going to basically do a little clean. And same thing. I'm going to draw 3 cc's. Now, the amount you use and what you use is going to vary by person to person for the particular condition which you're using it for. So this is not a standard. Always consult with your physician or your healthcare provider about what works best for you. This just happens to work well with this. Same thing. Slowly just... Those of you who do Botox in your clinic are very familiar with this procedure. And we'll mix these, draw them up, and we'll get ready for a procedure. Thanks.